The COVID-19 pandemic has been a serious health problem, but also for many people, an outbreak of severe economic hardship. That especially goes for neighborhoods such as East Boston, which has the highest rate of confirmed infections in the city, and many people who are prohibited or discouraged from using official safety nets. The problems are getting attention from public agencies, but also from neighborhood residents who've developed a network for mutual aid. To tell us about that are the co-coordinator of Mutual Aid Eastie, Dr. Neenah Estrella-Luna, and the co-director of two Boston organizations, the Center to Support Immigrant Organizing and the Center for Cooperative Development and Solidarity, Luz Zambrano. Thank you very much for being with us. I want to start with Dr. Estrella-Luna. This really began with community efforts before the pandemic. So tell us about the part that you're familiar with.
So East Boston is very lucky to have a lot of community-based organizations that have been very active for decades and a variety of different issues that face East Boston. And so a number of them that came together at the start of the pandemic that had been doing work prior to the pandemic include Neighbors United for a Better East Boston, which had been focused in particular for a long time on increasing civic engagement within the Latino community, within the immigrant community. And then we have other organizations in the neighborhood that essentially do similar things. And we all have been working together really for quite a long time around increasing participation in the community itself.
Luz Zambrano, at your organizations, you help immigrants get organized and to know their rights, but also to build economic capacities. So what does that mean exactly?
Thank you. Yeah, especially here in East Boston, the Center for Cooperative Development and Solidarity, born out of the need of the immigrant community to stay in the neighborhood because of gentrification. 5 years ago, East Boston started a process of gentrification. In a neighborhood that was 55% immigrants, we start seeing people being displaced. So we start this as an alternative for people to create their own business, cooperatives, workers-owned cooperatives. That means that immigrants who were doing cleaning or were doing childcare or were doing manufacturing stuff can come together and do something to actually be able to own their own jobs, their own work, and being able to survive in this neighborhood that it is really hard to afford right now. So that's what we have doing with the Center for Cooperative Development and Solidarity, bringing especially immigrants, undocumented immigrants who don't have any other way to actually survive this economy. That's the way we have it. So a lot of immigrants work 3 jobs, and even now with COVID-19, we see that they lost those 3 jobs and they don't have nothing. They don't have benefits, they don't have income, they cannot apply for unemployment. So the cooperatives, what they do is to actually create a safety net for these communities in our neighborhood.
Go back to Dr. Estrella-Luna. What about this? Because you have these compound vulnerabilities. You got the health, you got people who live in housing with more human density, you got more people out of work, and then you get people who either are beyond official safety nets or think they're supposed to be beyond safety nets. So what can mutual aid do about that?
So with the Mutual Aid Network, when we first started, we had one particular goal that we've been organizing around fairly successfully, and that was nobody is going to go hungry in our neighborhood. Nobody in this neighborhood should be hungry at any point. And that has actually been something that we have been very happily successful in doing. So, and we do that in collaboration. So the Mutual Aid Network is actually a collaboration of a variety of different organizations, primarily led by community-based organizing type organizations or community building organizations. And we've been working together both in terms of getting funding and then getting food out to people. So we also work, but we've also been working really strongly with organizations like the YMCA, Maverick Landing Community Services, so much larger organizations. We've been working in partnership with Boston, the Paris Street Community Center, which is a city organization. We've been working all together to make sure that people aren't hungry. But the other thing that we've also been doing in addition to that is, and really starting from the beginning, is making sure that people know what they need to know. So when the lockdown orders came into effect, we created videos, we created flyers, we put it out in the community. We have a WhatsApp that people can join from the neighborhood so that all of this information can be rapidly deployed very, very quickly. And so we've been doing that kind of work from the beginning, making sure people have food, which has also been the vehicle for transmitting information, and then also making sure that people have information that they need so that they can try to be safe.
Zambrano, when I read the information about eligibility for help from the government in English, which is my first language, I can get easily confused. I imagine people in East Boston might have that problem too, but maybe also there's a problem of trust. How do you help them with that?
Yeah, I think that's when all the community-based organizations come, to the plate, because we already have ties, we already have relationships with the community. So people trust when we talk to them, especially because we speak their own language. Because what we do is not just translate things from the legislative stuff, but we actually interpreted that so they can actually understand it. You can read a law in your own language and you can get really confused. So the idea is for us to read the law and make it in a simple way for people to understand. There is a lot of fear from people about public charge, especially because even if they understand what the law says in your own language, then you have the fear that what about if this change in 1 year? And then I go and I get tested for COVID-19 and I do my treatment for COVID-19. They said it's not a public charge, but what about in a year? They can change their mind. And now that I'm in a process of becoming permanent resident, maybe I'm going to be jeopardize my process. So those are the fears that people have. Even at the beginning when we say, no, you can just go to the clinic and you can be tested and this is not going to be a public charge, people still fear, like, okay, what about if in a year is not like that? So a lot of people haven't done it because they really feel like this is going to be to jeopardize my process.
Dr. Estrella-Luna, it's easy to look at the figure and see that East Boston has the highest rate of COVID-19 infections, at least as part of the overall population. But how do you go from that to figuring out what to do with it as far as testing is concerned?
Well, I mean, it's testing and then it's also later treatment because we do have a high infection rate. I mean, our infection rate, really, if East Boston was its own city, we would be right there with the city of Chelsea in terms of our infection rates. So a lot of what we do, both mutual aid and all the individual organizations, including the health center, we've actually been working really closely because, as Lou said, the community trusts us. They when we tell them, you can go there and you can do this, and here is what the health center is doing, and here is what we are doing to make sure that your identity is protected and that you that you are not going to be tied to this test in order to encourage people to do testing. And I've actually been very impressed with the health center taking on a lot of costs on their own budget. In order to ensure that the folks in the neighborhood can get tested safely, not only safely in terms of in the medical sense, but also safely for their own sense of being and sense of safety that they can stay in the country and stay in the community.
Luz, what does that mean for a family member to find out that he or she has the virus? Isn't that pretty important, because doesn't that change your mind about what you have to do as far as contact with people or hygiene?
Yeah, I think one of the things that we are experiencing is that, everything that they had said for the general public about, at home to have all these precautions, that you had to clean your hands, and then you had to have a social distancing, and you have to have a quarantine, and you have to have all those things. That makes sense for a lot of people, but for a lot of immigrants, it's not possible to do that. Especially here in East Boston, when the rents are so high, and when all this start getting gentrified, people start, 3 or 4 families start living in one house. So if one person gets sick, they don't have a way to have, quarantine or a place where they can just distance him from other people. So a lot of times they didn't even know that they have the virus. They came home, and then the other people got sick, and then you just tell them you can go, and you can be tested, and all these things are coming to your mind. It's just the stress that people are living into, even before COVID-19. It is amazing. We are not talking to a person that can say, I can go home and take care of myself. This is about families, 3 families living in one apartment. And the stress is so high. Sometimes at the beginning, they didn't have enough information. Then we gave them the information. And even with that information, people are still having doubts what to do, where to go, how this is going to affect me. And meanwhile, when they're thinking about that, people are getting infected. And I think that it was part of the problem, that it took people a long time to figure it out, what to do, to whom they can trust, what is the information that I need to follow, and what it can be in my benefit, and what can affect me in the future.
Finally, Neenah, we recently interviewed Kanan Thiruvengadam from Eastie Farm. So mutual aid is not just about getting support from the government or philanthropies. This is about people in the neighborhood doing it on their own as well, and doing it together. So if people want to help with this, is there some way they can follow up on that?
Yes, and I'd like to answer that, but I also want to piggyback on something that Luz said that's also very important. So yes, there's many ways that you can contact us. So we have a website through Eastie Farm actually is hosting our website right now through their WhatsApp Eastie page. And so you can sign up to help offer, whether you would like to participate with one of your abundances, whether it's your time or whether it's your skill sets that you might have, or if you have money, because everything that we do still costs money. To buy food costs money, to get cleaning supplies to families that are trying to self-isolate or self-quarantine costs money. To get masks, we have people in CCDS who have been making masks, so that costs money. So money is very important. If folks want to do that, they can certainly go to the Eastie Farm website to do that. I would like to also mention that as much as we are also about, mutual aid, which is neighbors helping neighbors, right? The scale of this problem is much bigger than what we can do ourselves. So when we have 2 families or 3 families living in one apartment, unable to self-isolate, and then infecting each other, and then infecting coworkers when they go, because a lot of our community are essential workers, that's a failure on the part of the government. So one of the things that the city of Boston should have done that they have not done is find places for people who need to self-isolate, who need to isolate because they are sick, so that they don't infect other people. The city of Chelsea figured out how to do that. The city of Boston, which is much wealthier, still has not figured out how to do that.